And we've done that analysis, and it's been very positive. If you talk to the CFOs for some of our hospitals, they can say this is the amount of hard ROI, that I've got delivered, and I feel like that was a very reasonable return on investment based upon what we invest in the Health Information Exchange.
For the health systems, we talk about helping them maintain their data, keeping their data clean, identifying their errors early rather than letting them proliferate through their system. So we talk about how much do you spend and how many people do you employ keeping your data clean. For the first time with the Health Information Exchange, there's a counterbalance, a counter check, if you will, and we can help you identify that sooner than later. That seems to be pretty significant. And then, of course, there are the usual kinds of answers that we've been hearing all along: eliminate redundant testing, eliminate the paperwork, the handling, the processing that goes on in the medical records area, and then also the business office helping to clean up some of those paper-laden processes and the time and energy that's saved by using a Health Information Exchange.
First of all, the most important return on investment is improvement in quality and delivery of care, preventing medication errors through the e-prescribe module of Elysium, and also decreasing redundancy and duplicative testing, being able to view through the continuum in the community all the tests that have been done on a patient, so that you don't, for example, order a CAT scan today that was done yesterday at another facility.
And we've been able to demonstrate savings on upwards of $30,000 per practice that's connected with the iHub.
For our hospital systems, building out interfaces to different EMR systems has provided them, an extreme return on investment. And of course, for physician practices, having a single interface through the RIO to their electronic medical records system is a huge, huge cost saver.
For example, we have one large group of family practice physicians that had implemented an electronic medical record, only their electronic medical record required staff in that office to take the results that we delivered to them. They printed them on pieces of paper, and then they had staff actually scan those and put them in the record. Well, that was ridiculous. So since we finally have been able to work on an interface with that practice, they've been receiving those results electronically from us now, and they go electronically from our inbound electronic data feed to them, go exactly to those patients' records in their system. And that has been the reduction of 2 full-time equivalents for that practice. Family practice residency program in our community, that they stopped pulling about 500 charts per day. And we know from research that a chart pull is about $5 per chart pull, which means you have to go first find the chart wherever it is in a busy practice, do what you're going to do with the chart, and then return it to where you found it. So if you just do the arithmetic on 500 chart pulls a day, the reduction in that, we're talking hundreds into thousands of dollars per day. Hardly a day goes by in our community in Grand Junction, Colorado, that we don't get thank yous from physicians because of the connectability and the ability to view information from handheld or any place they have access to the internet.